about the India Revival Mission on the Times Network. And the question really is, how do we find a way now in the weeks and months coming ahead? Some states may extend the lockdown. There may be an extension of the lockdown, especially in hotspots, in containment zones. But can we find a way to open up to some economic activity as much as possible, in fact, because the devastating impact of an extended lockdown is now beginning to show. The biggest impact really is the one on jobs.
As May the 3rd draws closer, it's time to look at ways of lifting Lockdown 2.0. While the government debates over lives versus livelihoods, it's jobs that are emerging to be the biggest casualty of the coronavirus pandemic. According to CMI's latest report, unemployment rate during the lockdown period ranges between 21 and 26%. The shutting down of businesses have seen 72 million people quit the labor market already. A report by SBI Research reveals that the retail sector is expected to see the biggest hit of the lockdown, potentially leaving 11 million people without employment. Other sectors expected to see layoffs include ride-hailing services, restaurants, e-commerce, and tourism. SMEs and startups too are proving to be the most vulnerable sectors as weak supply chains and limited access to capital are making business difficult. Companies like Oyo, Swiggy, Tribo, and Fab Hotels have already started handing out pink slips. Another survey has revealed that 61% SMEs are looking at scaling down operations, which may eventually lead to more layoffs. IT majors too have put a hold on fresh hiring. While Infosys says they will look at performance-related exits, Wipro says they may defer onboarding of new employees. Rajesh Gopinath of TCS, on the other hand, says they will honor all their offers, but they have decided to not hike salaries this time. The government has appealed to businesses to refrain from cutting jobs. But without financial support, most may find this very difficult. The only way ahead is to start businesses once again, and that too at the earliest.
So how do we save the jobs? How do we save the jobs? How do we save businesses, small businesses? And how do we ensure that there is no long-lasting economic impact? Is a grievous one really, which could in a way far outweigh any of the benefits that we've got from the lockdown and making sure that COVID-19 cases do not spread at an alarming rate. To speak on this, I'm joined today by an excellent panel of experts. I have Sangita Reddy with me, who's the Joint MD of Apollo Hospitals and of course the FICCI President. I'm speaking today with Sachchidanand Shukla, Chief Economist of the M&M Group, and Dr. Giridhara Babu, who's the head Lifecourse Epidemiology at PHFI. He's a well-known epidemiologist and is also a consultant on the COVID task force for the state of Karnataka. So we're going to get a lot of insight there. Welcome to all of you. Ms. Reddy, let me begin with your take on the basic premise that we've laid out. The lockdown was absolutely necessary. Extending it was necessary as well. But now, close to 40 days later, have we got enough information to decide what to do next instead of just a blanket extension?
Tamanna, clearly this is a difficult question. It's difficult for leaders. It's difficult for heads of business. And it's most difficult, I think, for labor and the starving and the MSMEs. So it is difficult. And I think a combination of data, of science, and of sentiment, both, all put together. And at a point of time when, I think it's being said that the epidemiologist is more important than the economist. And that's really, the scenario that we're in, that's what's guiding so much of what we do. I think the answer is really in a middle path. And that middle path is the fact, after the current scenario, we have a large number of green zones. We have a large number of districts, and I think also classification purely by districts is also too big. You need to take a 1 to 2 kilometer ratio around a hotspot and shrink the size of the hotspots continuously, as we saw that great town in Rajasthan do. So the time has come to say that we have to ease the lockdown. We have to continue to be very aware and cognizant about their health issues. the time which was gained in ramping up healthcare capability and educating public on how to protect themselves. Because at the baseline of this scenario, we have neither a cure nor a vaccine. We're going to be living with COVID for the next 12 to 18 months till they find this cure. Can we have a lockdown forever? We can't. So we have to have a calibrated opening, protecting lives and people, especially protecting the vulnerable, using data science and testing. So using the tool to give us more data as really the methodology. And with 50 million jobs lost and, any estimate of 40,000 crores to 25,000 crores per day as our daily loss for the country, we can't afford a blanket extension of the lockdown. We must work towards this middle path.
No, so where is the plan is then the question. So Shukla, if I can come to you, if we are hoping for some kind of a further easing of business, we know some auto companies have begun manufacturing. Some companies are trying to get business back on track, but it is truly difficult without a clear policy laid out. What can we hope to see to actually ensure that job losses and pay cuts don't deepen?
So Tamanna, I think it's very, very important that we understand what's happening. So while the common refrain and the theme was that while shutdowns were swift, I mean, across the world and similarly so in India, across states, we were very swift. Reopenings are going to be very, very gradual. It will be staggered across regions. It will be phased across sectors. So what we're talking about is three dimensions, which is spatial, temporal, and sectoral, which just complicates the things. So while we were given to understand that we have to react fast and all that, we could do that while shutting down. But the reopening part is going to be the trickiest. It's almost like that Abhimanyu's Chakravyuh, right? It's very, very difficult to get out of it. And what at the stage we are in now, the key question is how to balance the mortality rates, which is the lives of the disease, versus mortality rate due to the cure, which is the lockdown, amongst firms, especially MSMEs and a lot of businesses spread across the country. And I think what we're talking about now is the supply side. As we try and lift lockdowns either across states, across sectors, etc., the supply potential could be restored relatively quickly. And why am I saying that? Is that DPIIT has already made a SOP. It has submitted a list of industries to the Home Ministry that can be opened. They have given suggestions such as what kind of manufacturing units, what sectors can be reopened, what is the employee capacity, whether they should be working in single shifts, etc. And also across manufacturing, they've submitted. Similarly, the likes of FICCI, CII, all industry bodies have submitted some of these. But I think what is going to be more complicated is the demand side. See, balance sheets of households and businesses are going to be impaired significantly by the crisis. And to compound the problem, you will see uncertainty which will persist because you can see the second wave, etc., that we are seeing in Singapore and in Japan, where they had opened schools, etc., but they're forced to shut now. And the other problem is going to be confidence. Therefore, consumer behaviors are also likely to change. So I think this complicates the whole story, and we need to understand the three dimensions, like I said, and also supply as well as demand differently. And we need to address the families and the firms. So I think the first part the government has already done to an extent. They've taken care of the food part and also forbearances, etc. Now is the trickier part of how to handle the firms. I mean, if a business is likely to remain shut for, say, just about 1.5 to 2 months, not only will it not have any top line, it could lead to more than 80-85% plunge in its profits, which means they have to dip into reserves or borrow, wherein the role of the governments come into picture. And globally, we've seen the governments have stepped in, and we are hoping that the fiscal side will come in and just make up for those losses. So I think this is where we are right now in terms of the battle against.
Right. Well, the fiscal side and that fiscal package is being awaited for quite some time now. We're closing to this the end of the second phase of the lockdown. I just want to get a medical perspective in here. Dr. Babu, now you see doctors across the world with different views on how much you can open up. Do you agree with the basic premise that this cannot be now status quo, endlessly? Because we do not really know. No one has clear answers to when a vaccine will come up or when a cure will come up. In the interim, we have to find a way out.
Absolutely. So I think there's no doubt, and there's consensus throughout the world that there has to be a balance between how do you do mitigation, which means lockdowns, and also how do you then take care of lives with the livelihoods. So there are two themes here. Through these lockdowns and containment measures, we are trying to save lives. At the same time, you have to be very careful about how the livelihoods are taken care of. Similarly, we also have to balance between epidemiology and expectations. Now, as Dr. Shukla and Dr. Reddy clearly explained, there are expectations of the people, of the communities, of the vulnerables, and also if you look at the whole society as a whole, even the industry, there are a lot of expectations. So the policymakers definitely have to take in a cognizance of all the expectations out there. However, epidemiology, as Dr. Reddy clearly mentioned earlier, should be the guiding force here. Now, we have had tremendous gains. If you compare all over the world, we have been able to reduce the number of cases, contain the transmission, and also have fewer deaths. And all the doomsday predictions are over now. But can we let this success to wash away by allowing a sudden removal of lockdown? No, definitely not. Therefore, lockdown has to go, but then how it has to be removed is the question. So for that, three important things. One, we have to prevent from transmission from urban to rural areas, from high transmission to lower transmission areas, and also the new normal, what we are speaking of, physical distancing, and also trying to promote as much as work from home, use of masks, and personal hygiene measures. So these are the things that we should continue for some time from now, at least for the next few months, till we get a vaccine or a drug which has been repurposed for COVID management. I think this is the way we need to adopt and then be responsible at every level so that we don't lose on the gains.
What is the thinking right now within governments, within industry bodies? Dr. Reddy, if you could give us some insight. What is the thinking about how imperative and urgent the need is to move forward and open up the lockdown?
Tamanna, clearly, everybody's on the same page on this, that we need to open up the lockdown. We need to do it quickly. But I just want to reiterate on one dimension, that it's not just the demand side where a stimulus is very much required. We have to put money in the hands of the people. And the survey which we had done, FICCI, Dhruva together came out with this survey. Now we found that 83% of the companies said that the impact on their company was high or very severe. But the other survey, which was done by a different agency, and this is a very kind of important one, and I actually have it here. It's the COVID relief survey by Dalberg, and they actually said that 29% of the people, of 124 million people, they didn't do the whole sample, but that segment of migrant labor, 29% of them said they did not have money in their pocket to buy provisions for tomorrow. And they had no access and no understanding of where their next meal was coming. And I want to add another dimension to this 124 million people who are, migrant workers or MSME workers in that category in these areas, everyone except agri workers. And that is that 85% of them are male, and a majority of them are in the age group of 27 to 40. So the important point that I'm sure Dr. Babu will bear me out on that the risk of COVID infection is lower in a younger and healthier population. So who are we saying, please put back into the workforce? Is put the young and healthy, for who hopefully the COVID is going to be just like a flu or an influenza. And I want to share one more statistic with you, and that is actually two more. One is that when you look at the COVID infection, 85% of the people who get infected, it's going to be like a cold, a flu, a body pain, a throat pain, maybe, some loss of smell, the other, new symptoms which are coming up, but nothing major. 15% of them need hospitalization, of which of that 15, less than 50% of them need ventilator and advanced care. And the mortality rate, even in India, we're seeing is under 3%. So like was rightly said, we don't want to have a different type of mortality on livelihoods because we have been so good at protecting lives. And in a risk-free manner, we have to open up. And therefore, I want to add just one point, and that is that on the supply side as well, unless we do the economic package, even the supply side will not kick in. So you need the demand side to be given the financial stimulus, that's money in the hands of people. And you need to save the supply, which is the manufacturing, the industries, the sector, and ensure continuity of all businesses. And then extra relief for those sectors who have been especially hit or hurt, whether it's the healthcare sector, the restaurant, the retail, or the aviation. And then move on to say, what can we do for agriculture and rebuilding? So a multi-dimensional relief, which looks at immediate term, medium term, and long term, which helps us reposition ourselves for the change in the, the global alliances and the supply chain, but which takes care of, the country today, but in a safe manner. That's what all industry is propagating.
No, so do we have the mechanism to do this? Let me just get a quick input from Dr. Babu, and just taking the example of a few states, including Karnataka, that has opened up, some operations. Tell me right now, if you allow stores which sell non-essential items to open, allow them to be distributed via e-commerce chains right now, that may ease off some pressure on retail, may, unchoke the lifelines or the supply chains and the demand chains. Is that feasible? Do we have the technology to make sure that the people who work here and in these sectors, maybe through their age bracket or through rapid testing kits, etc., are safe?
So what Karnataka has done some relief, or some other states are even considering, the few principles of how you would relax these measures. Number one, I think we should be guided by the rate of how the cases are increasing. So RO, what we say, one infected person, how many people can he infect? So the epidemiology is the guiding force here. But what's happening is physical distancing. Can you ensure in a place where it's overcrowded? Let's say garment factory. Can you ensure physical distancing within that? So these are the times when one has to think very innovatively. And what we are saying is, I agree with Dr. Reddy saying that productive age group will not be affected more. However, everybody can get infected and they can give the infection to the elderly and the other vulnerables. Therefore, in epidemiology, now we are speaking in terms of reverse quarantining. That means protect the elderly, protect the vulnerable, make sure that people who are young and healthy are staying away from the people who are vulnerable. And for that, there are a number of provisions that several industries, even the industry bodies are proposing, where they want to take this responsibility of how can they do it? Can they maintain physical distancing? Can they ensure that there is enough decontamination in areas where there is problems? And also ensuring everybody wears masks at all times. That's another thing which all the industries are doing. So now physical distancing may not be possible in some places, but use of masks should be mandatory every time, all the time. That's how you are able to prevent the infection from going one person to another person. So therefore, what we are now looking at is, can we look at options where physical distancing and use of masks can be allowed in some industries? At the same time, make sure that we protect the vulnerables and also protect the transmission from going from a high zone to a low zone. I think this has to be a very calculated move, Mr. Madam.
The question is, and here I'm talking about the semantics, because everyone's in the same page of actually, that we have to open up sooner or later. We cannot stay in this limbo, pause button kind of space. What about smaller businesses? How will we ensure that smaller businesses also, take care of social distancing norms? follow all the regulations that have been put down, which are necessary, because we don't really have the infrastructure to monitor everyone at all times. That's why perhaps it's easier for governments and those in authority to say, let's just extend this till we figure it out. It's sort of kicking the can down the road. I'm giving this question to Dr. Shukla. What can be done to ensure that all levels of establishments and businesses follow the right norms?
I think it's going to be very, very important that we ease these restrictions gradually, like it is being done. What it will do is a great deal of hardship to a large number of households, right, from an income perspective, can be taken care of. And also because a lot of these services sectors may remain shut for a longer period, the onus is going to be on the manufacturing sector, some of these sectors that are likely to be opened up first. And this will also bring back at least part of the labor force to work and address some of these issues around unemployment and balance sheets that I spoke about. So if you look at the composition, I think 90% of the workforce is into unorganized. And even there, a bulk of it is in say, establishments which employ less than 10 people, right? So I think we have to be very mindful of the constraints within which some of these MSMEs, within MSMEs also, I think the concern is the first M, which is micro. And there, these people work in very small areas where some of these social distancing norms may be very difficult to adhere to. And therefore, I think we have to be very, very careful as to how we bring them back in a phased manner. So maybe some of those, say, the things like masks and some of the other preventive measures have to be really adhered to. We have to customize some of these preventive measures that we keep talking about in the context of the reality of how the micro say segment of the industry works. So the other part of the MSME, the last part of the MSME, the M, may not really have such constraints. Any establishment employing more than 50 people, etc., will probably be able to adhere to that. So I think, in my view, the focus has to be the first M of the MSMEs, where some of these may likely emerge as a bigger constraints than really being able to help the workforce come out and work. So I think we need to customize. We need horses for courses. We have to think on our feet as to how to bring back these people and how to enable a restart when we start easing these restrictions and lockdowns.
Yeah, I think Dr. Reddy wants to come in.
Yeah, so, Tamanna, at the risk of being, very direct on this one, I think we have to be very clear. 410 are our clean zones or green zones or districts without a problem. And of that, 85 of them who just got added to the list have been safe for the last 14 days. In those areas, you open up everything except even here, you continue to restrict retail, aviation, movies, restaurants, where physical, the social distancing is almost impossible. Manufacturing with social distancing only in clean zones, in green zones. That if we start following those norms, that would be a large step towards opening up. And that I think is really the first strategy which is probably going to follow. And Dr. Shukla rightly said that PPIIT has given a very clear and very comprehensive document where all associations we participated. We spoke about labor, transport, maintaining people, temperature controls, disinfection, and I'm calling it 2 S's and 2 W's. That's social distancing and sneezing and coughing etiquette, washing your hands and wearing a mask. So these 4 are the mantras that everybody needs to follow at least for the next 12 months or till a cure is found, irrespective of where they are. If you could be in a green zone, you could be at home, but you still need to follow some of these.
I just want to get your perspective, Dr. Reddy, on the jobs issue. And we mentioned it briefly in the beginning of the show, but I think it's important as well, because now there you're going to see a domino effect. You're going to see a cascading effect as as jobs have started disappearing at a faster rate, pays are reduced, it's going to impact demand, which was anyway weakened. What needs to be done? Do you think this is the first level at which we could hope for some government action?
So, Tamanna, I think we've been requesting, hoping, ideating, analyzing. The stimulus has to come. And the stimulus has to come in a manner which can ensure business continuity. And like I was saying, the longer we wait, the tougher it's going to be to recover. The longer we wait, the more corporations are moving into survival mode. And survival mode means you're cutting salaries or you're cutting jobs. Currently, the estimate is anything from 40 to 50 million jobs are already lost. And that is huge. And you rightly said it, that means that demand is going to be depressed. So unless we bring up supply, demand, and the supply chains all in one shot, think about them and start balancing them in the green zones and make that actually the incentive, saying you control your red zones and you move from red to amber and amber to green. This gives a further focus and an incentive for governments and the collectors and the state administration to keep containing their zones and come into the positive, and even for public at large. But again, I want to reiterate just one last line, is the message about fear has to go. Because even if you're in a green zone, and even if you still have your job, there are people who don't want to come to work because they're scared. And that is something that we have to put a realistic lens on the overall scenario.
Let me get a perspective on that from Dr. Babu, the realistic lens of the overall scenario. You know, there's it would be a big mistake to underestimate how deadly COVID has been. Luckily, India is not one of the countries that did that. We took this very seriously right off the bat, and we're seeing the fruits of that in a sense. Can we, with the data we have now in terms of mortality, details and granular data about which sections of society, which ages, etc., are most susceptible, can we now find ourselves in a position to craft an exit plan?
Yeah, so definitely there's data available which will guide us as we move forward. There are a few things that we need to be careful. How do we control, spread from high transmission to low transmission? So how do you control the borders? How do you ensure that the productive workforce is not getting infected from other areas? To do that, you have to map both the silent districts and the districts which are having high transmission. And what kind of containment measures and in the main zone and also the buffer zone that we are taking. That should guide number one. Number two is also very important, is in terms of our capacity. In case there is a surge in cases, what is the health system response? Do we have enough capacity in the ICUs and our oxygen supply and the ventilators? And this is where I feel the industry can definitely grow at an exponential pace. We are talking only the exponential pace of the virus, but the health sector itself can definitely grow if we can focus on what is our need for the capacity and then how do we actually mount that response. Just by focusing on the services alone in the health and public health sector, this can be the driver of the reforms in a time when there seems to be loom all around. Finally, how the data can guide and inspire is, there seems to be some areas where community transmission fear is going on. That can be prevented. That scare can go away by detecting something called SARI, severe acute respiratory infections. If we are able to enhance our testing capacity and then ensure that the SARI surveillance is going across every district in this country, and if that becomes the guiding force on how do we then scale up and start relaxing everywhere, I think we'll be in a definitely much better shape as we are already. But the challenge now is, once you're successful, how do you continue being successful? So other countries now...
My concern is the timeline for all of this. Because we're already seeing that towards the end of the second phase of the lockdown, a lot of state governments are looking at an extension and they might open up a little bit here and there. But the concern is, and let me come to Dr. Shukla on this, the concern is that is there not enough cognizance of the kind of damage that is being done right now as we speak to entire sectors and that trickling down to jobs, families, etc. And how long that would really take to revive?
Yeah, I think it's very important. What is, like I said in the beginning, we all knew how to get into this. It has to be synchronized and everybody acts together. But when it comes to even the state responses, Tamanna, I would like to tell you that the responses vary from district to district. Because what has happened is the district magistrates are in charge of their district. Anything related to lives or livelihoods, they are the ones who are monitoring. So even if you have a pass, for example, even if you belong to the essential sector or your company belongs to that or the factory belongs to that, it is his discretion whether he allows that person with the pass to be able to move or not. Similarly, you also need to look at raw materials and intermediate goods. You don't really have a very harmonious definition of what is an essential good. I mean, at the finished good, you have a very harmonious kind of a definition. But for that, you may require some inputs which may be intermediate or which may be raw material. And there, the definitions are not very, very harmonious or synchronized. And therefore, like you rightly said, each state is looking at it differently because they're using the lens of lives right now and not so much the economic damage, because at the unit level the DM or the chief minister is going to be ultimately responsible for the lives in his under his state or his watch. And therefore the issue of livelihoods actually right now at different places is taking a back seat. So what we will probably need is more interactions of between the center and the states, and within the state also across districts where these economic activities are concentrated. So I think you will need a much more holistic response, because at that unit level, one person or one official may not really have the whole picture or the whole view in terms of what kind of economic damage is it resulting in.
Yeah, Dr. I want to add to that, the nitty gritties of it, even as we speak, we see different states have done different things. Some have allowed some kind of stores to open, some are allowing some services to go ahead. It's pretty haphazard. Obviously, it will be decided by what the levels of infection are at that place. But do you think we need clearer central guidelines, or is it best to allow the very local administration to decide what the best case scenario is?
No, I think it's I'm sorry, was it to me or to?
Yes, Dr. Reddy, please.
Okay.
Yes.
So I think it's already fairly clear that the broad guidelines are coming from the center, but the execution of those within their local constraints are happening at the district level, and the collectors, under the guidance of their chief secretary, chief ministers, are playing a tremendous role. And everybody is evolving their own patterns. I mean, the other day I called up our village panchayat, and she said, not to worry at all, ma'am. We have a clear plan, and shops open for only 2 hours in the morning. We're maintaining the queues, and everybody is fine. Nothing to worry. Twice a day, people are coming and picking up the vegetables, so our farmers are able to sell their produce. This is an evolved methodology, and something that cannot fully be directed by the center. But the center said, enable the movement of essential services. So the essential service like food is moving across borders. But I want to quickly come on to your one very important point, which you said, non-essential on e-commerce. You asked that question.
Yes.
100% it should be allowed, simply because many of these items are also related to a big strategy of India, which is work from home, computer peripherals, printing cartridges, repair of the internet lines at home. All those of production and services we have to very quickly open also, because only that will enable the success of our larger strategy. So you started with food supply, then you move to some of these non-essentials, then you go a little bigger, then you say the neighborhood store with social distancing, then you extend the timing. So this is calibrated phase-wise, based on this multidimensional approach. But I think everybody's getting ready for it, Tamanna. I think the reality of the situation is there. The only missing link, honestly, in terms of visibility for us is where is the economic package? Because even if you open up, MSME does not have money to buy the supplies or to pay their workers. Yes. If that last bit comes, then the calibration will slowly happen. And India is smart. Our villages are smarter. And, things are on the ground. I'm very impressed with so much of what India and Indians are doing.
So we'll end on that note and that question about where is the economic package, because when we do open up, that kind of support will be required. Keeping everything shut for even longer would perhaps not be the right idea. We need to revive, we need to survive, and we need to thrive. I want to thank all of you for joining us on the show this evening.
Thank you.